Welcome, Dr. Elliott. My name is Muhammad Kadir. I am from Somali Community Resettlement Service. Today we are invited for Dr. Elliott from Alina Health. Welcome. Thank you very much.
Thank you so much. Looking forward to the conversation.
Thank you, Doctor. My first question, the community, they need to ask you, it's what is the vaccine?
So the vaccine is a tiny part of the virus. It's not the part that causes infection, but it's part that is changed in order to allow your immune system that's natural to your body to fight off the infection if you should get exposed to it in the community or in your regular life.
Thank you. How do we know if the vaccine is safe?
So that's a great question. So there are several parts to the answer. First is that the scientists are very good at making vaccines, and we know with great certainty how to make a vaccine that is very effective in doing what it's supposed to do, but also safe for your body so that it doesn't cause harm to you or to the people around you. This individual vaccine has been tested on many, many people throughout the US and throughout the world before it was made available to the regular public or even to healthcare professionals. So we know that it has been well tested, just like all vaccines are. And this individual vaccine has had a very good record of safety with very, very few complications. It does cause a little sore arm, and it might cause you to feel achy or tired or even get a little fever. That's not COVID, that's not an infection, that's your immune system responding to the vaccine in the way that's going to help you to become immune to COVID infection in the future.
Thank you. Who will be able to be vaccinated?
Yes, this is what we all need to know. So right now we're working on getting all the doctors and nurses and lab staff and everybody who works in healthcare vaccinated. Within a few weeks, we'll be moving on to the elders of the community, people who are over the age of 75. And then in late February, we'll move to people who are over 65 and people who have serious health conditions like diabetes, breathing problems, heart problems. So as it's your turn to get immunized, you'll be notified by your doctor's office that it's your time and you can make an appointment with your doctor's office or your clinic.
Thank you. Why do we need vaccine?
So as you all know, COVID has been very, very hard on our community, and some people get sick with it and are not terribly ill and can go back to their usual activities in 2 to 3 weeks. But some people, especially older people and people who have health problems, have gotten very, very sick. Many, many people have died. And some people, it appears, are going to develop a chronic illness that makes them weak and tired and ill for months and maybe longer after they get COVID. So we have a responsibility to get the vaccine to protect ourselves and our families, but also to protect the vulnerable people in our community from who may be become very ill and possibly even die if they were to get this particular infection. And so one of the ways we do that is by giving the vaccine. Even if you've already had COVID, getting the vaccine will help to protect you and the people around you, because it looks like you can get COVID a second time even after you've had it, and that can be a much more serious infection if you do get it again. So we want everybody protected, not only people who've never had COVID.
Thank you, doctor. Who can and should not get the vaccine?
So eventually we would like all older teenagers and all adults to get the vaccine. Right now it's being offered to the people who are most at risk first. So that's older people and people with health problems, people who work in high-risk occupations like in hospitals and clinics. We hope to be able to offer it to people who work in schools and in public health, in daycare settings, in nursing homes soon, so that we can get all of those folks safe and keep them healthy. It hasn't been tested yet in kids under 16, so we're not offering it for children at this point. And moms who are breastfeeding and women who are pregnant or planning to become pregnant should talk to their doctors, because it hasn't really been tested for those people. And we want to make sure that we're balancing the possible risks for pregnant women and breastfeeding moms with the benefits of being protected from the infection, because COVID is also very hard on pregnant women and breastfeeding moms. On the other hand, we don't 100% know how the vaccine works for those women. So talk to your doctor if that applies to you. Someday, maybe in the summer or fall, we hope to offer it for younger children, because they too can get sick with COVID and they can spread it in the community, even though they usually are not, don't get as ill with it.
Thank you, Doctor. When will the community get the vaccine?
So when you get the vaccine depends on how old you are, where you work, and what your health problems are. So if you're offered it by your job, please consider it. If you're uncertain, I would encourage you to talk with your doctor or nurse practitioner about whether it's a good choice for you with your individual health situation. If you are not offered it at your job, you'll be contacted by the clinic when it's your turn, or you may be offered it at a doctor when you come in for another problem.
Thank you, Doctor. If I get the vaccine, it is possible to get the COVID-19 again?
So, so after you get the first shot, about a week to 2 weeks later, you have about 50% protection from COVID. When you get the second shot, you have a week to 2 weeks later, you have about 95% protection. So that's pretty good. That's better, or as good at or better than most of the shots that we offer to protect against infections. So after you've gotten that second shot, you should still, of course, be careful, wash your hands, wear your mask in crowded places, avoid being too close to people who are not part of your family. But it's very, very effective. So it's very unlikely after you get your 2 shots that you would still get COVID. And if you're not able to get infected with COVID, you also can't spread COVID. So that's how it protects your community. If you're not accidentally sharing a germ that you didn't know you had, then it helps keep the other people in our area safe.
Thank you, Doctor. Do I need any insurance to get the vaccine?
Thank you. So the vaccine is free. It's free if you get it at your clinic. If it's eventually available at the pharmacy or at vaccine clinics, or if it's available at public health, wherever you go to get it, you should not have any payment. There's no copay. They may accept your insurance, but any part that your insurance doesn't pay for, or if you don't have insurance, you don't need it. If anybody asks you to pay for the vaccine or tells you they can get it for you if you pay them, that's not true, and you shouldn't go with that person. You should call your doctor's office.
Thank you, Dr. Elliott. I finished all questions I have. Before I go, I would like to ask you, what did you advise color of community? Because we hear it a lot of rumors who come from different ways.
Yeah. So vaccines are very safe, and the COVID vaccine has had many people who are experts in vaccines and in infections working on it, and I feel very confident that it's both safe and effective. If you are comfortable getting the shot when it's your turn, please do that, because it's going to be really important to keep our community and our neighbors safe and our families. If you're not comfortable, or if you're not sure if you want to talk more about it, please check with a healthcare worker that you trust, and you can go to your clinic, to your doctor, to nurses at your regular clinic or public health at Health Finders. We're all here to help you and to answer your questions so that you can feel confident in making the right choice for yourself and your family.
Thanks, Dr. Elliott. I appreciate your time. Have a good day. Bye-bye.
All right, take care.
You too, bye. Assalamu alaikum wa rahmatullahi wa barakatuh. Magacaygu waa Maxamed Khadar. Waxaan ka socdaa hay-adda dib-u-dejinta qaxootiga Soomaaliyeed. Waxaa maanta aan kulan ku marti qaadnay dhakhtarad ka socotay Alina Health oo ka howlgasha xarumaha magaalooyinka Faribault iyo Otana oo aan maanta su'aalo ku weydiinaynay ku saabsan talaalka COVID-19. Talaalkaas oo aanu isleenahay bulshada Soomaaliyeed su'aalo kala duwan oo fara badan ayay ka qabaan ayaa waxaan ku soo aruurinay dhowr su'aalood oo aanu weydiinay dhakhtaradda. Su'aasha koowaad oo u dhignayd sidan waxay odhanaysay waa maxay talaal? Sideen ku ogaan karnaa talaalku inuu wax dhib ah una lahayn? Yaa qaadan kara yaanse qaadan karin talaalka? Maxaan uga baahannahay inaan qaadanno talaalka? Goorma ayay bulshadu helayaan talaalka? Hooyada uurka leh iyo hooyada naaska nuujinaysa iyo dhallaankuba ma qaadan karaan talaalka? Haddii aan qaato talaalka, ma laga yaabaa inuu dib iigu soo laabto cudurka COVID-19? Haddii aan u baahdo inaan qaato talaalka, miyaan u baahanahay wax caymisa inaan la imaado ama insurance ah? Aad ayaad u mahadsantihiin. Su'aaluhuna waxay u dhignaayeen sidan. Dhakhtaraduna waxay uga jawaabtay siyaabo faahfaahsan oo aanu isleenahay bulshada Soomaaliyeed waxay ka heli doonaan warbixin dheeraada oo dhammaystiran. Aad ayaan idin salaamaynaa. Waxaan idinka tegaynaa nabad iyo caafimaad iyo barwaaqo iyo bashbash. La socod wanaagsan. Asalaamu calaykum waraxmatullaahi wabarakaatu.